Everything I've talked so far was more from the physician, right, perspective, right, from the research, from the clinical practice end of the equation. Now, if you look at it from the patient's perspective, I think the landscape is even more challenging. Why? Because patients face a lot of direct-to-consumer marketing, and they have to assimilate a lot of information coming from so many sources. And not all of them, like everything in life, not all of them hold the entire truth, right? If you unite the big gap in treatment in many of these conditions and the unmet clinical needs, that means patients that are in pain or are suffering are in search for a cure. And you link that with direct-to-consumer marketing that oftentimes they're offering therapies with certain claims that have not yet been proven. Well, that's a big challenge, right? Why? Because patients are at risk. Not necessarily at risk of adverse outcome, but you are at risk of multiple risks that are beyond just not improving. There is a financial risk. Patients invest a lot of money on many of these therapies without sometimes the clear understanding of what are the state of development and where we are with the evidence to support certain practices. If a patient were to choose to undergo one of the therapies with a complete and objective assessment of the information, and if that's within the regulations of the country where that's being done, well, that's fine. But usually that information remains a challenge. What are the things that are needed in the field to address this? And I think that ISCT has played a tremendous role as long as different societies around the world that have come together in an attempt to have a unified voice to help patients transit this challenging environment, is that these recommendations that are coming from different consortiums or different groups or ISCT committees or AOS or the Biologic Association, well, they bring some clarity where patients can use some reliable pieces of information of players that do not necessarily have a stake on the game, so that they can trust that it's going to be as unbiased as it can get, in order to really assess what's the state of the proven versus the unproven, and based on that, make more of an informed decision of the investment that they were to be made. And from the researchers and from the clinicians, I think we have the task and we have the responsibility of advancing research, conducting the clinical effective studies, and trying to work to get insurances to cover those treatments, that we get to the level that warrants coverage within the different insurance, so that patients don't have to withhold the burden of receiving these treatments in these areas that are so in need of a treatment.